Good evening. Welcome to another edition of the 411 Talk Zone radio show. My name is Leon Jones, and this evening we'll do another pre-recorded video. And next week I may do some live streams, but tonight I'm going to get right back into a disorder. I call it a mental health issue, and I'm going to talk about the bipolar disorder. So the title of tonight's video is the psychology behind bipolar disorders. The psychology behind bipolar disorders. Now, some people may think bipolar disorders are like having a Dr. Jekyll and Hyde personality. When you deal with something that is bi, you take on two personalities. So the information I'm going to give you, it's going to tell you about bipolar disorders and treatments. As you know, when we deal with psychology, psychology is about behaviors. Now, there are different psychological issues when it comes to behaviors. Now, one of the most important issues when it comes to behaviors that people don't recognize is environment, family, hereditary, or what is hereditary behind family? That's a big issue. Again, what type of environment were you brought up in? If you had a family, was it functional or was it dysfunctional? And see, it's very important that you understand bipolar disorders, because if you're going to get in a relationship with somebody, a lot of us, particularly men, we're guilty of looking on the outside. The problem with looking on the outside is you don't know if that person is stable. And when it comes to mental health is very important. Number of individuals who come with dysfunction can have an irrational behavior. And when it comes to somebody who is bipolar, they have two different personalities, and you don't know when both of those personalities are going to come and go. So when we deal with people with any type of disorder, the person who has the disorder must understand that they have a problem. Now, individuals who typically have problems are going to have a lot of denial. Let me give you an example. If you have somebody who is a smoker and you're not used to smoking, and you tell them that, hey, smoking is bad for you, and they say, no, it's not, that's because that person who believes smoking is not bad for them, they're immune to smoking. So they don't want to hear from somebody who doesn't smoke, because they believe that the person who doesn't smoke doesn't know anything about smoking. But we all know that smoking causes lung cancer. So when we get into bipolarism, we know how bipolarism is also an issue. Again, you're dealing with toxic personalities, Jekyll and Hyde personalities. These individuals could also be borderline schizophrenic. And there are a lot of other issues that can come out of a bipolar disorder. Now, the funny thing about behaviors is a lot of them are related to each other. For instance, what causes stress? Well, a lot of things cause stress. Your environment, the decisions you're making, they're all connected. But from stress, what can stress lead to? High blood pressure, cardiovascular disease, overeating. So when we deal with any type of psychological disorder or mental health issue, one must understand that The issue is about you. You need to get help. Many of us are afraid to get help. Now, I'll share my screen here, and we're going to talk about bipolar disorder. Now, again, when we deal with a bipolar disorder, we're basically, or we could call it a manic-depressive illness. It's a group of disorders characterized by the presence of pronounced high-energy phases known as manic episodes. Typically, unusual shifts in moods and energy manifest in increased activity levels, and basically, they impair the ability to function. Now, the impaired created by a bipolar disorder can be severe and can result in damaged relationships, poor job or skill performance, and even suicide. Now, when we deal with bipolar disorders, again, there's always a flip in moods, but there are different types of bipolar disorders. And here they are. You have bipolar 1. The bipolar 1 disorder refers to a condition in which an individual experiences a full-blown manic episode for at least 1 week and may or may not also experience depression. So the manic symptoms may be so severe that hospitalization is required. Now, when we have a bipolar 2 disorder, that refers to the presence of a current or past hypomanic episode. That's a current or hypomanic episode, which is a slightly less severe form of mania lasting at least 4 consecutive days, as well as the presence of a current or past episode of a major depression. Then we deal with a cyclothymic disorder or cyclothymia, and that refers to recurring hypomanic and depressive mood shifts over at least a 2-year period. Now, I'm going to give you some statistics here. Now, again, when it comes to statistics, a statistic is a sample and statistics tend to shift. So you need to understand the trends of statistics. But I'm going to give you some statistics when it comes to bipolar disorders from the NIMH, and that is the National Institute of Mental Health. So according to the National Institute of Mental Health, an estimated 4.4% of adults in the United States experience bipolar disorders at some point in their lives or some point during their lifetime. Now, the condition occurs with equal frequency amongst males and females. So the median age of onset is 25 years. Nevertheless, bipolar disorder may begin in childhood or may have its onset late in life. Now, bipolar disorders are typically chronic conditions and require lifelong management. More than 50% of people who have a single manic episode go on to have recurrent episodes of mania or depression. Now, for people who are experiencing a manic episode are often described as excessively cheerful or feeling on top of the world often. However, the dominant mood during a manic episode is you're very irritable. So additionally, persons experiencing mania may display sudden inflated self-esteem, decreased need for sleep, talkativeness, distractibility, and often engage in activities that have a high potential for painful consequences. Now, when I talk about painful consequences, and I'm going to get into the video next week, we're going to deal with gambling addictions, but terrible consequences could be sexual indiscretions, heavy spending, and gambling. So when we have those consequences, we then move over to hypomania. Now, hypomania is similar to mania in that the disturbance in mood and the change in functioning are observable by others. But the episode is not severe enough to cause major impairment in social or occupational functioning or to require hospitalization. So basically, During any manic episode, a person may start multiple new projects and feel that they are capable of accomplishing anything, regardless of their level of experience or talent. Now, one of the most common features of mania is a decreased need for sleep. So, a person may go days without sleep, yet not feel tired. They're sleep deprived. Now, often a manic depressant or a manic person's thoughts race faster than they can be expressed, and the result may be abrupt shifts in topic, impression, and incoherent speech. So sometimes during a manic episode, people display hostility and angry tirades, particularly if the attempt is made to interrupt them. Children who are at risk for bipolar disorder, perhaps a parent has the disorder as well, display a developmental sequence beginning with the symptoms that are not specific to bipolar disorder, notably sleep problems and anxiety. Now, the condition progresses from minor mood disorder to major depressive disorder in adolescence, with full blown bipolar disorder developing in the transition to adulthood, typically with an episode of mania or hypermania or a first episode of psychosis following an episode of depression. So, one thing you must understand, it is characteristic of the condition that those who are experiencing mania do not perceive that they are ill or in need of treatment, and they also resist engaging with treatment. So basically, when it comes to treatment, there's going to be diagnosis. Now, diagnosis and treatment are incredibly important. Why? Because the lifetime risk of suicide amongst individuals with bipolar disorder is at least 15 times that of the general population. So bipolar disorder is often not recognized or may be confused with other conditions, and people may suffer for years before they receive appropriate treatment. Now, again, with any disorder, you must read the DSM-5. The DSM-5 is a diagnostic statistical manual for mental disorders. So, with any mental disorder, there are going to come symptoms. So, according to the DSM-5, a manic depressant or a manic episode is a manifest in excessively euphoric, expansive, or irritable mood for most of the day, every day for at least a week. And it's accomplished by abnormality, and it's basically persistently increased with activity and energy. Now, in addition, 3 or even 4 of the dominant mood is you're basically irritable. And with all the irritability, the following signs are going to be present. Now, these are some of the symptoms. This is all under symptoms. Again, according to the DSM-5, a manic episode is manifest in an excessively euphoric, expansive, or irritable mood for most of the day, every day for at least a week, and is accompanied by abnormally and persistently increased activity and energy. That's abnormally. Now, again, 3 or 4 of the dominant mood is irritability. Now, of the following signs that will be present. Number 1, inflated self-esteem or grandiosity, including unrealistic beliefs in one's abilities and powers. 2, decreased need for sleep. 3, you're very talkative. So to put it all together, you're going to have unusual talkativeness or pressure to keep talking. You're going to have a flight of ideas or the sense that thoughts are racing. You're going to be distracted. You're going to also have an increased goal-directed activities such as work or school projects or purposeless activity. Now we're going to deal with the psychomotor or agitation. That's purposeless activity. And then you're also going to have involvement in activities that are likely to have painful consequences, such as buying sprees, sexual indiscretions, poor business investments, and even gambling habits. So, in addition, the mood disturbance is sufficient to cause significant impairment in social or occupational functioning or to require hospitalization to prevent self harm or because there are psychotic features. Now, what's more, the episode is not explainable by ingestion of a medication, drug, or abuse or medical condition. Why? Because the more moderate form of mania, also called hypomania, similarly involves an equivocal change in functioning, albeit for 4 or more days, but there is typically no significant social or occupational impairment. Now, indeed, the person may feel good and highly productive, making it difficult for the person or those around him or her to identify a hypomanic episode. So basically, bipolar disorders are typically marked by the occurrence of at least one depressive episode. Now, a depressive episode is characterized by a depressed mood, loss of pleasure or interest, or feelings of hopelessness for at least 2 weeks. So, according to the DSM 5, at least 5 of the following symptoms are present. Again, according to the DSM 5, which is the Diagnostic Statistical Manual for Mental Disorders, at least 5 of the following symptoms are also present. Again, according to the DSM, at least 5 of the following symptoms are also present. You're going to have the sad, anxious, or empty mood that's present most of the day, every day. Loss of interest or pleasure in all of the activities is spent most of the day, every day. Unintended weight gain or loss, insomnia, or excessive sleep. Observable restlessness, or we call it psychomotor, or I'll just call it psychomotor agitation, or even slowing down, psychomotor retardation. There's also going to be fatigue or loss of energy nearly every day, feelings of guilt or worthiness, diminished ability to concentrate, or you're going to be very indecisive. You're also going to have reoccurring thoughts of death, suicide, or suicide attempts. So the symptoms can cause distress or impairment in functioning, and they are not due to the effects of a substance or medical condition. Now, sometimes severe episodes of mania or depression include symptoms of psychosis. So common psychotic symptoms are hallucinations, hearing, seeing, and otherwise sensing the presence of things that aren't actually there, and delusions, false, strongly held beliefs not influenced by logical reasoning or explained by a person's usual cultural concepts. And just like I explained before, bipolarism leads into other types of disorders. You just heard me talk about hallucinations and delusions. So, when we start talking about something being psychotic, is there a chance that there's going to be some schizophrenia involved? Well, delusions, you can say having a delusion or false belief is, I can say that's borderline schizophrenia. But as I explained to you before, when it comes to mental health, now again, I'm not a mental health professional. So if you are a mental health professional, in the comment section, correct me if I'm wrong. I'm just laying out my point of view based on the Psychology Today article. So as I continue, we deal with psychotic symptoms. And basically, when you have psychotic symptoms inside of bipolar disorders, what happens is they tend to reflect the extreme mood state at the time. For example, illusions of grandiosity, such as believing one is the president or has special powers of wealth, that may occur during mania, delusions of guilt or worthiness. Again, you see that word delusion that's popping up. And I did a video earlier on delusion. Again, and when I'm plugging in bipolarism, you have a lot of people who are very delusional. They have this irrational thinking, not realistic. Again, this comes from psychotic symptoms. And again, psychotic symptoms in bipolar disorder tend to reflect the extreme mood state at the time. Again, the examples are delusions of grandiosity, such as believing one is the president or has special powers or wealth, and that may occur during mania. Delusions of guilt or worthlessness, such as believing that one is ruined and penniless or has committed some terrible crime, and it may appear during the depression. So for this reason, bipolar disorder is sometimes incorrectly diagnosed as schizophrenia. That's true, but there are delusions of grandiosity, and delusions are part of schizophrenia. Now, in some people, however, symptoms of mania and depression may occur together in what is called bipolar disorder. Again, some people, symptoms of mania and depression may occur together in what is called bipolar disorder with mixed features. Now, symptoms of mixed features often include agitation, terrible sleeping, significant change in appetite, psychosis, and suicidal thinking. So a person may have a sad and hopeless mood while at the same time feeling extremely energized. Again, you're two people. You're one person with two different personalities. Let me correct that. When you have a bipolar disorder, you're one person with two different personalities. And let me go one step further. You have two different moods. And moods can alter your personality. That's what bipolar disorder is. You know, on one hand, you're depressed, and on the other hand, you're energized. So episodes of mania and depression typically recur across the lifespan. So between episodes, most people with bipolar disorder are free of symptoms, but as many as 1/3 have residual symptoms. So a small percentage experience chronic, unremitting symptoms despite treatment. So basically, people with bipolar disorder can live healthy and productive lives when the illness is effectively treated. Without treatment, however, mood cycling can increase in frequency and severity. So both children and adolescents can develop bipolar disorder. The condition, however, is most likely to affect the children of parents who have the illness. So children and young adolescents often experience fast mood swings between depression and mania multiple times a day. Mania in children is most likely to manifest as irritability with proneness. Again, mania in children is most likely to manifest as irritability with proneness to destructive tantrums. Now, the occurrence of mixed symptoms is also common in use with bipolar disorder. So older adolescents who develop the illness may have more classic adult episodes and symptoms. Going back to children, bipolar disorder in children and adolescents can be hard to distinguish from other problems that they may occur in these age groups. Why? Because irritability and aggressiveness can also become symptoms of attention deficit hyperactivity disorder, known as ADHD. Again, you see how the dots are connecting? ADHD, that's attention deficit hyperactivity disorder. And there's also conduct disorder. And there's oppositional defiant disorder. And also, something you must understand with people who have bipolar disorders, alcohol and drug abuse are very common amongst people who have bipolar disorder. Now, many factors contribute to the substance abuse problems, including self-medication of symptoms. Nevertheless, mood symptoms can be brought on or perpetrated by substance abuse. This may exist risk factors that influence the occurrence of both bipolar disorder. Again, there may exist risk factors that influence the occurrence of both bipolar disorder and substance use disorder. Again, as I repeat myself, there may exist risk factors that influence the occurrence of both bipolar disorder and substance use disorders. So basically, co-occurring substance abuse when present must be addressed in an overall treatment plan. Now, we go into something called an anxiety disorder. Again, all these disorders, mental illnesses, they basically are related and they all connect. So moving on, anxiety disorders such as panic attacks and social anxiety disorder may also occur in people who have bipolar disorder, and they may respond to treatments used for bipolar disorder, or they may require separate treatment. So, what is a rapid cycling bipolar disorder? Very easy. When 4 or more episodes of illness occur within a 12-month period, a person is said to have rapid cycling bipolar disorder. Some people experience multiple episodes within a single week or even within a single day. So rapid cycling tends to develop later in the course of illness and is more common amongst women than in men. Now, as we talked about the symptoms, there are also causes. So the causes of bipolar disorder is subject to much research, and the consensus among scientists is that there is no single cause. Rather, many factors act together to produce the illness. Now, I told you about what is hereditary in the family. You also have to deal with genetics. That's right, genetics plays a role. One of the strongest risk factors for developing bipolar disorder is having a family history of the illness. Now, the risk of the condition is increased tenfold amongst adult relatives of individuals with bipolar 1 and bipolar 2 disorders. Again, bipolar 1 is in my humble opinion, that is a major disorder because it lasts longer. Bipolar 2 disorders, they're disorders, but they're shorter. However, no specific genes have been linked to the condition. Rather, as with many other mental illnesses, multiple genes, each with a small effect. So, psychotic disorders occur with greater frequency in the families of those with bipolar disorders than in the general population. Studies of identical twins who share all of the same genes indicate that factors other than genes, such as highly stressful events, also play a role in precipitating bipolar disorder. So many genes are likely to act together in combination with factors in a person's environment. I mentioned environment earlier. Now, brain imaging studies show that the brains of people with bipolar disorders may differ from those of healthy individuals. For example, researchers have identified several brain regions marked by the reduced thickness of the cortex. And other studies show that processing of sensory stimuli is implied during episodes of mania and depression and may underlie errors in perception. So, you have some people out there who have thyroids. Now, is a thyroid gland function linked to a bipolar disorder? Well, people with bipolar disorder, particularly those with rapid mood cycling, often have abnormal thyroid gland function. Too much or too little thyroid hormone alone can lead to mood and energy changes. Our thyroid levels are usually they're being carefully monitored by a physician. So generally, because of the mood and energy changes with the thyroid hormone, the levels of thyroids, they're usually carefully monitored by a physician. So lithium treatment may cause low thyroid levels in some people, resulting in the need for thyroid supplementation. Now, we talked about the symptoms, the causes. Now, what about the treatment? So even in the most severe cases, bipolar disorders are highly treatable conditions. The sooner the treatment begins, the greater the likelihood of reducing the severity and frequency of manic and depressive episodes. So because disorders or bipolar disorders, because bipolar disorders are lifelong conditions, treatment is also lifelong and aimed not just at treating symptoms, but also at preventing recurrence of symptoms. Why? Because most people with bipolar disorders can achieve substantial stabilization in their mood swings and relative symptoms. Let me make a correction on that, not relative symptoms. Most people who have bipolar disorders can achieve substantial stabilization of their mood swings and related symptoms. Again, most people with bipolar disorders can achieve substantial stabilization of their mood swings and related symptoms. So, the most effective treatment strategy combines medication and psychotherapy. In addition, patients are also instructed to keep a chart of the mood symptoms. Again, the strategies come twofold. They come with medication and psychotherapy. So patients are often instructed to keep a chart of daily symptoms, treatments, sleep patterns, and life events. Such tracking has been shown to help patients and their families to better understand and manage the illness. So mood changes can be spotted in time to prevent a full-blown episode. So even when there are no breaks in treatment, mood changes can occur and should be reported immediately to the doctor, who may make adjustments to the treatment plan. Now, we dealt with the treatment. So what about medications? Well, under medications, and I'm going to say this, while primary care physicians who do not specialize in psychiatry may prescribe psychotropic medications. Now, it is recommended that people with bipolar disorder see a psychiatrist for treatment. So, several types of medications are commonly used to treat bipolar disorders. Mood stabilizers are generally prescribed to control manic episodes. Lithium is perhaps the best known mood stabilizer. The mood stabilizing medication is approved by the U.S. Food and Drug Administration for the treatment of mania. It is often very effective in controlling mania and preventing the recurrence of both manic and depressive episodes. So, other types of mood stabilizers include the anticonvulsants, lamotrigine or lamictal, valproic acid, which is known as depakine, and of course, the valproic sodium, depakote, and of course, tegretol, and others. So, valproate was FDA approved in 1995 for the treatment of mania. And if I did not pronounce the medical terms correctly, I apologize. I'm a civil engineer, not a physician, but I am utilizing this material to study bipolar disorders, because no matter what profession you're in, you have a number of individuals who have bipolar disorders and they're walking around normal. And I will post this information under the video. Now, we also have other medications like anticonvulsant medications. And they're basically combined, and they may be combined with lithium or with each other for maximum effect. Other medications are added when necessary typically for shorter periods to treat episodes of mania or depression. Sometimes treatment with antidepressants that result in mood switching, prompting a manic or hypomanic episode or rapid cycling. Now, mood stabilizing medications generally are required alone or in combination with antidepressants to protect against such a switch. So, children and adolescents with bipolar disorder generally are treated with lithium, but valproate and carbamazepine are also used. So, moving on from anticonvulsant medications, we're going now to antipsychotic medications. And they're also used to control manic and depressive symptoms in bipolar disorder. And some help to stabilize the mood as well. So you have antipsychotic drugs that include olanzapine or Zyprexa, Seroquel, Risperdal, amongst others. Now, insomnia is sleep deprivation. If that's a problem, a high potency benzodiazepine, that's right, benzodiazepine medication such as clonazepam or lorazepam may be helpful. However, because these medications may be habit forming, they are best prescribed short term. Other types of sedative medications, such as zolpidem, are sometimes used instead. So, something else that you might understand, you can find those in multi-pack vitamins, omega-3 fish acids. That's right, omega-3 fish acids. Now, where's that found? I'm going to tell you the answer right now. It's basically found in fish oil. So you can go to GNC and buy some multivitamins, and they have omega-3 fatty acids in them. So again, omega-3 fatty acids found in fish oil may also be useful alone or when added to conventional medications for long-term treatment of bipolar disorder. But even with all that, what about medical care? Well, medical care under treatment, because basically, yes, you have the medication, but you have to manage the symptoms. You have to manage this mental health disorder. It's not just the medicines. So effective management of bipolar disorder may involve changes to the treatment plan at various times over the course of illness. So that means any change in type or dose of medication should be made under the guidance of a psychiatrist. Now, to avoid adverse reactions, patients should tell the psychiatrist about all other prescription drugs, over-the-counter medications, or natural supplements they may be taking. Because when it comes to medication, one must understand that all medications have side effects. Now, depending on the medication, side effects may include weight gain, nausea, tremors, reduced sex drive, anxiety, hair loss, movement problems, or even dry mouth. So getting the right balance of treatment benefits may require physician-monitored adjustment in dosage or type of medication. And remember, medication should not be changed or stopped without the psychiatrist guidance. Now, we also get into psychotherapy because studies have documented that several kinds of psychotherapy provided to patients and their families can lead to increased mood stability, fewer hospitalizations, and improved functioning in several areas. So, psychotherapeutic interventions commonly used for bipolar disorder are cognitive, and I've said this in a number of my videos, goes right back to CBT. CBT stands for cognitive behavioral therapy. So, what I'm saying is psychotherapeutic interventions commonly used for bipolar disorder are basically cognitive behavioral therapy. And what is that? You also include education, family therapy, and interpersonal and social rhythm therapy, which is IPSERT. And IPSERT emphasizes the importance of establishing stable daily patterns of sleeping and walking and prolonged wakefulness. And that is a known trigger for manic episodes. Again, IPSERT, that's dealing with family therapy, interpersonal and social rhythm therapy. Now, with everything, you have to be educated because education involves teaching people with bipolar disorder about the condition and its treatment and how to recognize signs of relapse so the early intervention can be sought before a full-blown episode occurs. Education is also helpful for family members. So IPSERT, I don't know what IPSERT is. I'm going to tell it to you one more time. IPSERT is interpersonal and social rhythm therapy. It's interpersonal and social rhythm therapy. And that's used to help people with bipolar disorder, both to improve relationships and to regulate daily routines. So maintaining a daily routine and a sleep schedule can help protect against manic disorders. Now, what about electroconvulsive therapy? That's known as ECT. Well, in critical solutions such as psychosis or suicidal thought, where medication, psychosocial treatment, again, in critical situations such as psychosis or suicidal thought, where medication and psychosocial treatment and the combination of these interventions prove ineffective or work too slowly to relieve severe symptoms. Electroconvulsive therapy, ECT, may be considered. So ECT, which is electroconvulsive therapy, may also be considered to treat acute episodes when medical conditions, including pregnancy, make the use of medications too risky. So ECT is a highly effective treatment for severe depressive, manic, and mixed episodes. So the possibility of long-lasting memory problems has been significantly reduced with modern ECT techniques. So what is the most common treatment for bipolar disorder? Mood stabilizer drugs are often prescribed to prevent mood swings. Lithium, perhaps. Lithium is probably the best mood stabilizer, but newer drugs such as lamotrigine have been shown to cause fewer side effects while frequently obviating the need for antidepressant medication. Now, what type of therapist should be considered for bipolar disorder? Well, just like every profession, you need a licensed professional. So a licensed psychologist, social worker, or counselor typically provides treatment therapies and often works in concert with a psychiatrist to monitor patient progress. So with CBT, that's cognitive behavioral therapy, it helps people with bipolar disorder learn to change inappropriate or negative thought patterns and behaviors associated with the illness. So family therapy helps reduce the level of family distress that may contribute to or result from the ill person's symptoms. Now, again, when we deal with bipolar disorder, what is it? Bipolar disorders, or some people call them manic-depressive illnesses, they're basically a group of disorders characterized by the presence of pronounced high energy phases known as manic episodes. They typically have unusual shifts in mood and energy manifest and increased activity levels, and basically they also impair the ability to function. So the impairment created by bipolar disorder can be severe and can result in damaged relationships, poor job or school performance, or even suicide. Now, again, the information came from Psychology Today. I will post a link under the video. Now, basically, what I'm telling you is a lot of these disorders and mental illnesses are associated with each other. The bottom line is you don't know if you have them unless you get checked out. And you have individuals who are walking around normal and they have a bipolar disorder. ADHD is tied to bipolar disorders. Signs of irritability, irrationality. The biggest one that's tied is delusion. People have their own beliefs, even if they're not realistic. So the bottom line is, when it comes to any disorder, you have to get educated about it. But even before that starts, you have to recognize that you have a problem. A lot of us are in denial. Even though we're normal, we think we feel good when we're sick. And some of these disorders, they're causing a violence out here. They're causing lifestyle changes like gambling. A lot of people have gambling issues. A lot of people mismanage money. Some poor choices are made because of bipolar disorders. But you also have to check out your family, genetics. Again, bipolar disorders affect children and adults at the same rate. You're going to get different actions. You know, adults don't, well, some adults have temper tantrums. But sometimes we may laugh at somebody, but we don't know if that person isn't sick or not. Now, again, it's up to that person, the individual person, to get themselves checked out, because when they have an issue, particularly one of mental health or some psychological issue, could not just damage themselves, but could damage loved ones and people that are innocent individuals that you work with. You have a lot of episodes out here. And some people might think, well, there's nothing wrong with him or her, when there is. Again, I'm going to say this. You have a lot of walking zombies out here. And the bottom line is, the problems, how do we fix the problems? Well, I just gave you the causes. I gave you the symptoms. And I gave you the treatments. Yes, the family can be a good support. Medication can also help. But again, with medications have a lot of side effects. And again, something that was mentioned, some of these medications can alter sex drive. And you know, guys, particularly the ones 40 and older, if you're bipolar, you're taking some of these medications to help bipolarism, you could end up with low T as well. So just because you have a medication, it doesn't mean that it's suitable. So it's going to take somebody who is in the mental health or public health professions, like psychiatrists or psychologists or any type of mental health professional, to reduce the dosage. Because, again, medications do have side effects. And my problem with medications is, once you get on medications, you got to keep taking them. So is the medication really helping? It helps the symptoms temporarily because you have to keep filling the medicines. So when it comes to anything, you have to look back at your family. What kind of history do you have? Genetics. Many of us don't do that. In fact, many of us are even unaware that we have issues of bipolarism or ADHD. And what I'm doing is I'm giving you an overview. Now, again, I am not a mental health professional, but I'm giving you an overview because what I see out here today is a lot of bad behavior. And we don't know where this behavior is coming from. Now, I can give you a little facts. It all starts with the family, but also you have to look at the environment. Number of individuals are going to represent the environment they're from. So if you come from poverty, your mindset is going to be poverty. The question is, how do you fix it? Because there's some people who can get out of a situation, but they take that mindset to a new situation that's not prevalent in the new situation that was prevalent in the old situation. A lot of things are about mindset. When we deal with mentality, we deal with the mind. And before you can change your actions, you have to change your mind. So if you have issues with mental disorders, it's up to you to correct those mental disorders because we can have the biggest support system in the world. But when it comes to bipolarism, how do you really manage it? I mean, all of us come with a bag of issues. Some of us hide the issues very well. But you have hormone changes, depression, high energy, insomnia. You even have delusion. They're all tied to bipolar disorders. So, I've been saying this. You have to take care of your health, whether it's physical or mental, because it's going to affect how you live. And it's also going to affect the type of lifestyle decisions you make. Again, poor money management, poor decisions. I mean, you even heard drug and alcohol abuse. That's connected. So what I'm telling you is, if you have a problem, admit you have a problem. You can't get help unless you know you have a problem. And you can't be embarrassed by saying you have a problem. A number of us are prideful. We deny that we have a problem when we do have a problem. Mental health is a problem, especially bipolarism. And if you look at it, a number of us are walking around like zombies today. You even have young people depressed. It's all about antidepressants. But I just want to say this before I close. When you have bipolarism, the biggest thing you need to do is get some help to manage it. Because if you don't manage it correctly, what's going to happen? You're not only going to hurt yourself, but others. So when it comes to bipolarism, understand that number one, it comes from family and genetics. Number two, the different mood swings with bipolarism. But overall, understand that it is a mental health issue. Get educated. And don't be embarrassed. Don't care about what anybody says because they may have issues themselves. But understand you only live once. So while you're here, do everything that you can to make sure that you live a normal life. And that's my commentary for this edition of the 401 Talk Zone radio show right here on YouTube. If you like what I just presented, please comment, share, and subscribe. And if you're looking for some educational content, check out the QCIS channel, formerly the Mind of STEM channel. On that channel, you get a daily dose of science, technology, engineering, and math. Now, if you cannot find the 401 Talk Zone radio show or the QCIS channel on YouTube, you can find both of those channels on Twitter. Now, because the QCIS channel is an educational channel, you can also find that channel on LinkedIn. Now, may do a live next week in the new year, and I'm going to continue to talk about behavioral topics because I believe it's important that we understand the types of behaviors that we see and that some of us have. Because in the end, I'm going to say this: be blessed for what you have. Don't worry about what you don't have. Always know that the sun rises in the east and sets in the west. And if it doesn't apply, let it fly. But if the shoe fits, wear it. If you don't like the shoe, change it. And once again, thank you for listening to this edition of the 411 Talk Zone radio show right here on YouTube. Till next time, my name is Leon Jones. I want you all to have a wonderful and gracious evening. God bless you. I'm out.